My name is Adrian Dix. I'm BC's Minister of Health. To my left is Dr. Réka Gustafson, who's the Vice President of Public Health and Wellness for the Provincial Health Services Authority. She's a Deputy Provincial Health Officer, and she runs the BC CDC. This is our COVID-19 briefing for British Columbia for Monday, November the 2nd, 2020. We're honored to be here on the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations. Tomorrow, Tuesday, we'll be providing a written briefing, Dr. Gustafson and I, on the COVID-19 situation in British Columbia. On Wednesday, Dr. Henry will be returning and providing with me a written briefing on that day at around 3 o'clock. And then on Thursday, Dr. Henry will return. Dr. Henry, because I know people are always interested, is taking a couple of well-deserved days off, although like all of us, she'll be, I'm sure, spending a lot of that time thinking about how to deal with the COVID-19 pandemic. And so with that, it's my honor to introduce Dr. Réka Gustafson.
Good afternoon, everybody. I'm Réka Gustafson, Deputy Provincial Health Officer, and it is my pleasure to provide you an update today. Today we are updating on 3 reporting periods, being Monday. From Friday to Saturday, we had 352 new diagnoses of COVID-19. From Saturday to Sunday, there were 389 new cases, and from Sunday to Monday, 379 new cases, for a total of 1,120 new cases over the weekend, over that 3-day period. That brings our total in British Columbia to 15,501 cases of COVID-19. New health authority cases, to give you a sense of where the majority of transmission are occurring, there were 234 new diagnoses in Vancouver Coastal Health, 830 in Fraser Health, 9 in Vancouver Island, 36 in Interior Health, and 10 in Northern Health. Since the beginning of the pandemic, there have been 90 new cases of COVID-19 in individuals from outside of Canada. At the moment, we have 2,945 active cases, of whom 90 are currently in hospital. 19 are in critical care or intensive care units. Since the last reporting period, we've had 6 new individuals who have died from COVID-19, for a total of 269 deaths in our province. 5 of these individuals were in Vancouver Coastal Health and 1 in Fraser. And we would like to extend our condolences to their families. At the moment, we have 6,448 British Columbians under active public health monitoring. There are 3 new healthcare outbreaks reported in this period: the Good Samaritan Delta View Care Centre, the Hamilton Village Care Centre, and the Rotary Manor in Dawson Creek. 1 outbreak, the Bailey House outbreak, was declared over. At this time, we have 28 active outbreaks in the healthcare system, 26 in long-term care facilities and assisted living, and 2 in acute care. There have been no new community outbreaks, and the outbreak at JL Beef is now over. A reminder to everybody to please continue to regularly check Health Authority website for community exposures, which are updated regularly. And if you've attended one of those locations, to please follow the instructions. So these numbers are concerning for all of us. But we have learned a great deal about COVID-19 since the beginning of the pandemic. We have learned that what living with the virus looks like and what we need to do to keep ourselves, those around us, and our communities safe. Monitoring the epidemic closely, testing to identify new cases, contact tracing to contain further transmission, and using our layers of protection are cornerstones of our response. These are the tools that we continue to use as we navigate this pandemic in the coming months. Our goal is to continue to minimize severe illness and death, balanced with keeping it as much as possible open and active in our communities. As the weather gets cooler, and I think everyone's noticed that the weather has gotten cooler, and our activities move inside, we are going to see fluctuations and surges in some communities. We know this from British Columbia, we know this from around the world. The recent increased cases in the Lower Mainland, and particularly in Fraser Health, are an example of this. And when we do experience these surges, we need to respond with increased effort and stepped-up focus using all of the public health measures we have available to us. We know that being inside and in close contact with others increases our risk, and that has been a significant cause of new cases in recent weeks. That's why it's important to keep our groups small, at home and elsewhere. Despite this challenge, and despite what you might have seen in some images this weekend, the vast majority of British Columbians are spending time with others in safe ways. This past weekend, I saw some great examples of families enjoying Halloween safely. As we look ahead, it is important for us to continue to pay close attention to the COVID-19 transmission in our communities. Just as we have adopted our response, as we learn more, so we need you to do the same. Staying well means staying safe. It means all of us always following the COVID-19 safety basics all the time. This includes washing hands, using a mask when you can't keep a safe distance from others, and following the safety protocols of your school, your workplace, your business. If you are older or otherwise vulnerable to severe illness, it is best to avoid all crowded situations and limit your number of contacts. If you know there is transmission in your social circle or in your community, and you do develop symptoms, keep in mind it does mean that COVID-19 in that situation is more likely. Please arrange to get tested as soon as possible. If you are a contact of someone who has tested positive for COVID-19, please do participate fully in contact tracing. Respond to the calls and answer the questions as fully as possible. Please remember, public health is here to help, not to judge. So just to close, I just want to acknowledge that we are entering the 11th month of this pandemic, and social connection is very important to our personal and community well-being, and we need to continue to live well and live safely. It is not about stopping our lives, nor is it about being careless. It's about learning how to do the things that are important to us safely, and we have learned a great deal together in the past months. Thank you, and I'll now take your questions.
Thank you very much, Dr. Gustafson. And first of all, to start, I wanted to acknowledge the 6 people who passed away from COVID-19 this weekend in British Columbia. All were in long-term care. 5 were in the Vancouver Coastal Health Authority, 1 in the Fraser Health Authority. This is an extraordinarily difficult time for families, especially for those living in long-term care. It's an extraordinarily difficult time to grieve. We've seen that in the challenges that people have with respect to grieving and our inability to come together in these moments. So I want to, on behalf of the Premier, but really everyone in British Columbia, pass on our condolences and say that our thoughts are with all the families, are with all the communities, are with all the caregivers, are with all the friends of the 6 people who passed away, and all those who have been affected, whose health has been affected in this pandemic. I want to note, obviously, that 1,120 cases is a lot of cases over 3 days, and this is a significant challenge, particularly in Metro Vancouver. If you look at the location of the cases, 830 in Fraser Health and 234 in Vancouver Coastal Health. I know that we have 90 people in hospital, and our acute care hospitals continue to manage well the pressures of COVID-19 and all of the other things they're trying to do. We've done in recent weeks record numbers of surgeries in British Columbia, for example, and that is an enormous achievement for our healthcare system. With that in context, 53 people in hospital are currently in hospital in the Fraser Health Authority and 37 in the Vancouver Coastal Health Authority. There is no one in hospital in the other 3 health authorities. This is also and this reflects the extraordinary work of Dr. Gustafson and her team and all the public health officials, some of whom who do contact tracing. I had the opportunity to meet on Thursday when Dr. Henry and I were in Surrey at the Fraser Health Authority offices. I just note that there are 295 active COVID-19 cases, 945 active COVID-19 cases, 6,448 people under public health surveillance. There were 24,771 COVID-19 tests performed over the weekend. Over 2 days, 5,000 calls to 811. And I think what this reflects is the extraordinary efforts that have been made to build our contact tracing capacity in British Columbia. 523 people hired in Thursday's report, and the extraordinary work that people are doing throughout the healthcare system, but obviously not just the healthcare system, but people who work in service industries, in grocery stores, our extraordinary teachers in British Columbia and others who are doing, I think, an extraordinary job on all our behalfs. And all I can express is my gratitude to all of them. Part of a reflection of this, and as you know, on Monday, I give an update on our PPE situation in British Columbia. You will note that as of last week's report, Monday, October 22nd, BC, the following PPE had arrived in BC since March. Just over 7,300,095 or equivalent respirators, over 75 million surgical or procedure masks, almost 2.8 million pieces of eye protection, including goggles and face shields, almost 173 million pairs of gloves, and almost 12 million gowns. I wanted to note that over the past week, and this is an extraordinary achievement for the people working in this area, we a further 52,366 N95 or equivalent respirators arrived in BC. And this number is astonishing: 49,256,652 surgical or procedure masks, 29,000 pieces of eye protection, 19,137,775 pairs of gloves, and 772,730 gowns. This is an extraordinary achievement for people who work at the Provincial Health Services Authority and the Ministry of Health and in the health authorities, and I'm very appreciative of their work as it continues to ensure that our healthcare workers have the PPE they need to do their courageous work on behalf of all of us. I wanted to note that WorkSafe BC, it's not just the health system, has been doing a significant work. I wanted to note the work of prevention officers there, that over 17,600 workplace inspections to review employers' COVID-19 safety plans and assess the effectiveness of protocols have been performed during the pandemic by WorkSafe BC. 627 orders have been written requiring employers to create or update their COVID-19 safety plans to ensure the health and safety of workers. And so I want to express my appreciation for that work that's being done to ensure that COVID-19 protocols are being supported in the workplace. I also wanted to give a first report on our health recruitment initiatives. As you'll know, on September 9, 2020, the government announced the hiring of 7,000 individuals in the health system across 3 major initiatives. And I want to note the following, that on the first part of that initiative, because this had been directed earlier on June 30th, we issued guidance to support family and social visitation in long-term care and assisted living, and announced up to $160 million for increased staffing to support visitation. As of October 26, 2020, the allocation estimate, the money that has been provided, is $122 million provided to operators, and and this is part of the effort that is being put in place to support infection control and to allow more visitation in long-term care equally. In terms of the initiative, the healthcare support initiative, support worker FTE or health career access program, initiative, I just want to note that we've received already 8,188 expressions of interest from all over British Columbia in response to this initiative, and that initiative is underway and proceeding, and we'll have more to report in coming weeks. But what it says is that in terms of long-term care, the effort and the initiative to put in place and to ensure that long-term care facilities are safe and that we can in fact allow more visitation in future has required an extraordinary investment. And I am heartened by the thousands of British Columbians who want to be part of the solution, who want to work in healthcare, who want to provide in these challenging times, have stepped forward to say that they want to work in long-term care. And there are, of course, extraordinary opportunities to do that, and that work is so needed now. In closing, I want to say that obviously this is not an easy time for anybody, And Dr. Gustafson, I think, said it very well, that we're human beings. And as human beings, our greatest strength sometimes can be our greatest weakness, our desire to be together, to support each other in difficult times and in good times, and at celebrations of life and at weddings. That our desire to be together, our desire to party together can sometimes be our greatest weakness in a time of pandemic. Those connections that we count on, our need to come together, are the things that COVID-19 seeks to spread. We know what we need to do to stop the spread. We know how to do it, and we must all do it right now. COVID-19 has had its turn, and you see that all around the world, where we are in a significant new phase of the pandemic. And we must now act to give COVID-19, to respond to what COVID-19 is doing in our province, to get our own house in order for the cold weather ahead. We need to seal the cracks and close the gap that COVID-19 exploits to make us sick and to claim lives. The COVID-19 tide is rising. You can see that in the numbers. It is powerful, but we can be stronger, and we will be stronger. Dr. Henry, Dr. Gustafson, and public health officials have taught us what to do to keep our families, our friends, and our communities safe. And we've shown we know what to do. We've proven that we know how to do it, and we need to do that together right now. Right now, we again need to turn the tide on COVID-19 in BC. And I believe we can do that. And part of how we do that, is to follow the guidance provided by public health officials. Part of what we do that is to follow, of course, the orders, which are the law of public health officials. And part of how we do that is to be compassionate and generous to one another in these times, and to contribute, all of us, to allowing us to do the things we want to do, to ensure that children are in school, to ensure that surgeries take place, to ensure that business can thrive. All of these things depend on all of us. And I ask everyone listening to us today, and all the people that you might talk to the rest of the day, to recommit themselves to the task of stopping the spread. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 3 périodes de référence de 24 heures chacune, soit celle des 30 et 31 octobre, celle des 31 octobre et 1er novembre, et celle du 1er jusqu'au 2 novembre en mi-journée. Il y a eu 6 nouveaux décès liés au COVID-19 durant ces 3 périodes de référence. Nous offrons nos condoléances aux familles et aux amis des 269 personnes décédées du COVID-19 et tous ceux qui ont perdu des êtres chers au cours de cette pandémie. À ce jour, 12 207 personnes dont le test de dépistage de COVID-19 était positif sont maintenant rétablies. Pour la première période de référence, nous avons eu 352 nouveaux cas. Pour la deuxième période de référence, nous avons eu 389 nouveaux cas. Au cours des dernières 24 heures, 379 nouveaux cas se sont ajoutés. Il y a aussi, cela représente 1120 nouveaux cas depuis notre dernière mise à jour vendredi, pour un total de 15 501 cas en Colombie-Britannique. Parmi l'ensemble des cas confirmés de COVID-19, 90 personnes sont actuellement hospitalisées, dont 19 en soins intensifs. Les autres personnes dont le test de dépistage a été positif sont en isolement à leur domicile. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. And a reminder to the media to please press *1 to line up for questions. We will be taking one question and one follow-up this afternoon. And also, please do not mute your phones. You will not be heard until I call your name. We begin today with Jennifer Stoltman, Vancouver Sun. Jennifer, go ahead, please.
Oh, hi there. I was hoping you could talk about COVID-19 exposure and transmission on public transit. How susceptible are people who are riding transit, and have there been any instances in BC?
Thank you very much for your question. And it's actually a common question, And there are very good safety protocols on BC Transit. And when we actually do contact tracing for COVID-19, we're looking at where people have been in the last 14 days. And so to specifically determine whether transmission has occurred on transit may not be possible, but we have some very good indication that it's not a major source of transmission. And that indication is that to date, the vast majority of people in British Columbia, after some investigation, are able to identify where they were infected. So their source of infection is known. Most of us don't know who we're on transit with. And therefore, if we thought that places like transit and other areas where we have casual contacts with people were a major source of transmission, then the proportion of people who didn't know where they were infected would be much higher. I would also like to re-emphasize that we've also implemented some important safety protocols in public spaces, such as transit.
Do you have a follow-up, Jen?
Yes, please.
Sure, go ahead.
As you said, contact tracing can be difficult, and there are a lot of people coming and going, and it can be difficult to track. How confident can we be that transit is not a factor, and what would it take for there to be a public notification or an exposure outbreak declared? Like, what's the threshold?
Again, if there were an exposure, for example, on a transit such as a bus on which you are for several hours, there may be a public notification in a situation like that. But again, if you add up the summary of evidence, the totality of evidence about where transmission is occurring, it does not occur through casual contact, does not occur in places where people have safety protocols in place. And although there may be a notification, initially we had notifications, for example, for other forms of transit, such as airlines, but we are finding that those are not major sources of transmission. So we're focused on our contact tracing and our public notifications on situations and in places where transmission actually is occurring.
Thank you. The next question comes from Richard Zussman, Global News.
I'd like to ask about whether we will ever get information around a regional breakdown in terms of where these cases are being identified in a larger Fraser Health area, and whether, connected to the weekend, whether there were any measures being put in place to address areas like the Granville Strip before Halloween, and how does this factor into an event like New Year's?
Okay, so I can answer. I actually don't have specific information about the measures that have been put in place on the Granville district. I don't know if Minister Dix does. I don't have that information. Can you repeat your first question?
Yeah, about regionality. There are
Yes.
a lot of people in Surrey I'm hearing from saying, why won't you release information by neighborhood or by smaller regional districts so people can understand where this boom and this virus is happening?
We're actually working hard to provide more and more granular information. I think your question is a really good one. We know, as I mentioned before, that COVID-19 is transmitted in known chains of transmission and outbreaks. And the more information you have about your community, the more empowered you are to take precautions as needed. So we actually are working to provide that information in as visually appealing and as easily understood manner as possible. So I think it's a good question and it's a good request, and we're working to provide that in as granular a way as possible.
Yeah, and as you know, Richard, we provided more and more information. We provided, month to month, more information by local health area and obviously regular information by health service delivery area. The one thing I would say, though, to people across British Columbia is that this is a worldwide pandemic. There are approximately, I believe in France today, which has an organized public health system, 60 cases. The 7-day rolling average was 60 cases a day per 100,000, which was, I think, 9 to 10 times what it is in British Columbia, just to put that in context. So what that tells us, though, if you look at the rest of Canada, you look at what happened in Winnipeg 2 months ago and what's happening now, is that COVID-19 is a worldwide pandemic. It can affect us everywhere, and it's why we need people to take action everywhere in British Columbia, because the situation can change. This is COVID-19 is something designed to transmit, and so, or at least so it appears. And so we have to be ready and determined everywhere. With respect to the Granville Strip, I mean, I think there's steps we have to take everywhere, but one of the things that is particularly obviously frustrating for the overwhelming majority of people who are following public health guidelines and public health orders is to see that, because it was in public and because you could visually see what was going on, and some of the behavior was beyond the public health orders, simply disgraceful. But I would say this, that one of the order that Dr. Henry brought in last Monday with respect to private residences is important. Some of those events, which have seen a lot of transmission, and we review, as you know, every case, have occurred not with cameras around and not in the way we can visualize, but indoors, in private gatherings, sometimes relatively small gatherings. And so what we're asking people to do, especially in the season of gatherings and the season where it's colder and the season when the days are shorter, is to strictly limit that. And that's why the maximum of 6 is in the public health order, and that's why our advice to people is to avoid such gathering and stick within the home circumstances to the people who live in the home. This is one way, and we see this from the evidence that public health sees every day, that we can stop the transmission of COVID-19.
Do you have a follow-up, Richard?
I do. I'm just wondering, Dr. Gustafson, or even Minister Dix, whether there's an update on the COVID-19 app and the conversations, why are there still concerns around this as an additional tool, the federal app? And are contact tracers, are people being moved out of the healthcare system right now, those who give immunizations or vaccines, are they being moved out of those positions right now to help contact trace?
With respect to the contact tracing app, I do want to let you know that we reviewed that app very, very carefully, and we reviewed it with the people who do contact tracing and do a lot of contact tracing and do it very, very well. And based on the features of that app, mostly because of the type of information that's provided to individuals, it wasn't felt that at this point in British Columbia it would have additional benefit, would be additional value to the existing contact tracing. The other thing that I'd like to say about apps and digital tools is that we are learning every single day. And while we may not have been entirely clear on what digital tools would be helpful for us in BC, we are, as the epidemic evolves, as our skills and our workforce in responding to an epidemic of this size are evolving, we are actually identifying the digital tools that will be helpful for us and that are helpful for us, and those are being developed and rolled out as we speak.
Yeah.
And I'm going to hand it over
as you'll know, Richard, we're obviously have done a lot of work, and Dr. Henry, Dr. Gustafson, and others work very closely with federal officials in other provinces, and so we're going to continue to do that. I think our goal is to ensure that any additional app in British Columbia contributes to the situation and does not make it harder to do contact tracing. And so that's our goal, and we haven't stopped working with the federal government on these issues and other levels of government. We're going to continue to do that, and I think what Dr. Gustafson said is the important point. We're going to, on this question of the COVID app, follow the advice of the people who do this work, the people in public health who do contact tracing, not just during pandemics, but all the time. That is their job and their, in some ways, their specialty in life. We're going to follow their advice first and continue to do so on this question and on others like it. With respect to the hiring of contact tracers, as you know, between 500 and 600 people have been doing this work since the beginning of the pandemic. Many of them have other jobs. And so one of the reasons we're building up public health, why we announced 500 more people to do this work, why we've hired 523, why by the end of this week, I believe it'll be more than 600, and why we're going to add 800 to 800 so that public health is able to do not just contact tracing, but all the work that it does. And this is a key part of what we've been doing. It's why we started in advance of this fall period, which I think everyone understood was going to be difficult given respiratory illness season. And it's why we started doing that work in the summer. And so what we're doing is building up the overall strength of public health, and that means doing all of the work of public health. But this work has been particularly important in recent weeks when you have more than 6,000 people who are being monitored by public health. Adding hundreds of highly qualified people to support our efforts is a good idea, and I'm very proud of the work they're doing, and having had the opportunity to see some of them in action on Thursday, for example, I can tell you they are extraordinarily committed.
Thank you. The next question comes from Shannon Patterson, CTV. Shannon, go ahead, please.
Oh, hi there. With numbers this high, and now we see other Canadian cities and regions around the world bringing in tougher restrictions for indoor dining, non-essential businesses, what will it take to bring in tougher restrictions here if this number over a weekend isn't concerning enough to look at cracking down? What number would be?
So I would not say that there's a specific number. There's a number of things that we are monitoring all the time to understand the impact of the pandemic on our community. And the things that we are monitoring are the number of new diagnoses, how rapidly they are changing, whether or not we can identify where people have received where people are able to identify where they were infected, our ability to follow up cases in a timely way, our ability to continue to provide testing, and as well as keeping in mind what the ultimate goals of pandemic control are, severe illness and minimizing deaths, is monitoring those indicators as well, and looking at how we are managing this pandemic. This pandemic is something that we are managing, and the tools in our toolbox are contact tracing, testing, contact tracing, as well as additional and specific interactions or interventions that we need to do in response to surges. There's also public health measures that we are all doing throughout British Columbia all the time, and these are our tools in our toolbox. So I would say that there isn't a single number. There is a team of public health professionals that are monitoring the epidemic, its impact on our population, its impact on our healthcare system, and are also monitoring our ability to control it and respond. So at this moment, we have a concerning number of new infections. At the moment, we're also, the hospitalizations are stable, the number of people in ICU remains stable, and these numbers and these indicators are being monitored all the time.
Do you have a follow-up, Shannon?
Yeah, for Minister Dix, one Metro Vancouver Police Department told me today they've issued 4 tickets in the past couple of weeks to people from out of country who they caught outbreaking quarantine. A couple were discovered through routine traffic stops, the others from tips from the public. Are you worried that feds aren't doing enough to monitor and enforce people arriving from other countries to quarantine?
Well, I think it's a good opportunity to remind people of their obligation, their absolute obligation to self-isolate when they return to Canada. This is anyone who comes to British Columbia and who comes to Canada. And so I believe that significant efforts, and as you know, British Columbia took the lead in Canada on this question because of the seriousness with which we take this issue. Remember that COVID-19 as a pandemic in many parts of the world has much more severe circumstances, and indeed in many parts of Canada, than we have in British Columbia, even with the numbers on this weekend. So that's absolutely necessary. It's something that we review regularly with the federal government. It's our expectation that the federal government will do its work, and I think it is. But it's also our expectation that people who return to Canada fulfill their obligations to their families, to their communities, and to the country, and ensure that they they self-isolate for the prescribed period. And you know, I'm interested to hear the story from the police officers that you've heard from, but we have to continue to monitor this question. The one thing I would, though, repeat is that we have, and you have seen, a significant public health order last Monday from Dr. Henry and from our team around gatherings in people's homes. That we also see, and the important role that WorkSafe is going to have to play and continue to play in ensuring that we monitor COVID-19 in workplaces, because we've seen significant outbreaks in workplaces, and we have to continue to do this work. But those are public health orders that limit people to 6 people outside those living in the home. And there's also public health advice in Fraser, that Fraser Health, that it might be less than that. So when we focus on issues, it's because those issues are the sources of transmission. And when public health gives an order, it's based on the evidence. It's based on a detailed analysis of this evidence by some of the most qualified people in the world. And so all of this is done methodically and with an effort to reduce the risk of the population, and also to limit transmission. So those are the steps we're taking. So yes, international travel is one of those aspects, and it's an important one, but so I want to repeat are the orders put in place by Dr. Henry last Monday.
Thank you. The next question comes from Xiao Zhu, Globe and Mail. Go ahead, please.
Hi, Dr. Gustafson. I want to follow up on what you said about the COVID-19 app. So what is it specifically about the app that seems to be concerning, and why would the app make contact tracing more difficult? Thank you.
I'm so sorry. I'm going to ask you to repeat your question. I had trouble hearing.
Okay, yeah. Hope to ask, what is it specifically about the app that BC finds concerning, and why would the app make contact tracing more difficult? Thank you.
Well, that's an excellent question. So the app that in its current state can inform an individual that they were exposed to COVID-19, but it isn't able to notify and tell them when, how long, what they need to do, how intense that contact was, how close that contact was, when it occurred, and what they need to do about it. So one of our challenges is that in order to act in a meaningful way on an exposure about information, you need to have some details about it, so you know whether or not that's an actual exposure, whether you need to seek, you need to self-isolate, whether there's a significant risk to you of COVID-19 above and beyond the background risk. And I think that's the other thing to keep in mind, is that we all know that COVID-19 is transmitted and circulating in our communities. So there are certain basic things that we all need to do all the time. We monitor our health. We isolate if we become sick. If we have any symptoms, we stay away from people who are vulnerable. We seek testing as necessary. We wash our hands. We wear masks. All of these things are basic things that we all need to do. So being told that you were near someone with COVID-19 doesn't change any of that. It's what you would be doing as a background activity all the time. What we're working toward in British Columbia and with our federal partners is to improve these tools to allow us to provide information to people that is in addition to that background regular behavior that we need to maintain during a pandemic, during a global pandemic. And that's what we're working toward, to make sure that the information that any digital tool is able to provide is providing people with information that would change their behavior based on that information.
Do you have a follow-up?
Yeah, I think, hope that so last week Dr. Henry said there are some parameters built into this app that she doesn't feel work. And I wonder why she thinks the app doesn't work for everyone else except Alberta seems to think they work. Thanks.
Well, I think at the moment, I believe a lot of provinces have signed on and are evaluating the app and using the app in their communities. And this notion of does it work depends on what your goals are. And here in British Columbia, our public health teams are reaching people, are doing contact tracing, and are able to give the specific information that somebody who has been in contact with COVID-19 needs in order to make a meaningful change in their behavior that reduces the risk to the people they love and to their communities. So at the moment, based on what we see here in British Columbia, the additional information provided by the app wouldn't add to the existing ways and methods of contact tracing. Again, this is right now in BC. We're all continuing to develop tools, to develop methods and ways of reaching people who have COVID-19 or who may have been exposed to COVID-19, to give them the specific and meaningful information that allows them to make the changes in their behavior based on that information.
Thank you. The next question comes from Marcella Bernardo, News 1130.
Thank you both for taking my question. This essentially is for Mr. Dix. You mentioned earlier that it's simply disgraceful what we saw happen on the Granville Strip in downtown Vancouver. What specifically are you prepared to do to bring these numbers down? Because it seems like a lot of people are ignoring orders. So what next if people are not following the orders that are already in place?
Well, thank you. Thanks for the question, Marcella. And I think the point I want to put into context here is that the orders that and what we've seen in recent weeks is the impact on COVID-19 transmission, principally in Fraser Health, of events that are held in private residences. And so we took action on that and gave a very clear change in what is the law with respect to such events last Monday. And so that is strong and clear action. And I think when you're strong and clear on these questions, I think people are anxious to follow that. There have been, from time to time, and we've dealt with them. I can recall events that occurred in around the third week in March, when there appeared to be a lot of people at English Bay as we were dealing with some of the initial really very serious phase of the pandemic at that time. We've seen other situations develop over time that have been concerning to people, and we have to continue to respond to them, I think. But what we have to also focus on, and what we are focused on, is ensuring that workplaces are safe, ensuring that long-term care is safe, and that we can hopefully, by adding staff and supports, allow more visits in long-term care, that we take action where we see transmission occurring, and that is what you see going on. But look, all of us could see what was going on Granville Street. It was on TV, it was on social media, and I can imagine the frustration of the millions of British Columbians who are following the rules of that conduct. And it was a challenging situation for the Vancouver Police Department, and they've spoken about what occurred. But look, we have to, we're facing COVID-19 for a long time to come, for months and months and months and months and months and months and months to come. We're going to be dealing with COVID-19. And for us to do all the things that we want, to have children in school, to have surgeries performed, to have businesses operating, to have some normalcy in these extraordinary times in our lives, we need to follow public health guidance and public health advice. And whether it's Workplace BC or whether it's local law enforcement or bylaw officers, there is a role for enforcement, but we also need people, all of us, to be part of this effort. And that has been our goal from the beginning. I think that's one of the things that has been so effective by Dr. Henry and Dr. Gustafson and so many others in public health, and it's what we're going to continue to do. But obviously that, like all events, are going to be reviewed, and in light of the number of events facing us in the next little while, we're going to have to prepare for that as well.
Thank you, Marcella. And before I ask you for a follow-up, if reporters are asking questions, I request you to please turn off your speaker while asking questions. Please do not be on the speakerphone. Marcella, do you have a follow-up?
I do. Hopefully you can hear me. Let me see if this works. For Dr. Gustafson, is there any way that you can give us any specific events you're linking to recent spikes since Thanksgiving, perhaps any cases that have been linked to polling stations on Election Day?
So the types of, we do review all of the types of places where COVID-19 transmission is occurring. And there has been no, to my knowledge, there has been no transmission associated with polling stations. Polling stations were one of those situations where voting is a very important thing to do, and there were safety protocols in place. The things that are important to do to us with the right safety protocols can be done, and voting was certainly one of them. The types of places where the types of gatherings that have been associated with transmission tend to be larger gatherings in people's private homes as opposed to in a place such as a restaurant that has a safety protocols or a venue that has a safety protocol. So the types of places where we have transmission are gatherings, what we would call sort of uncontrolled gatherings in someone's home, where there is unnecessary crowding, where there are too many people, and there aren't the safety protocols in place because it's in a person's home and they hadn't thought to have safety protocols in place. That's why one of the reasons that we want to keep, those are the reasons we want to keep numbers small in areas where there's transmission, especially small. And again, the order is the start. And if you are going to have a gathering, if you are going to get together with your friends, do so in a place such as a restaurant or a venue that has developed safety protocols. So many places in British Columbia have learned to operate safely. And so those are the kind of settings. We do see transmission in some workplaces, but again, it tends to be outside of the areas where there's safety protocols. One of the interesting things I'm learning from people doing the contact tracing is while we often associate outbreak with a workplace, again, the transmission often occurs among social networks and among individuals who are getting together with a larger group of people outside the workplace. And so those are the types of places where transmission is being seen, and the safety protocols that exist in workplaces have actually been strengthened. They continue to be strengthened, and so those types of places, transmission is actually quite limited.
Thank you. The next question comes from Moira Witten, the Tyee.
Hi, Dr. Gustafson and Minister Dix. Thank you for your time. My question is about how you're planning to further engage youth and to tailor guidelines to their behaviors and constraints, like people living with roommates or in multi-generational homes who don't really have the luxury of working from home necessarily.
Sorry, can you repeat the question?
Sorry, I think everyone's having a go. How are you planning to further engage youth and to tailor and communicate guidelines for their behaviors and constraints?
So with respect to youth, I think this is a really important question, and I don't know if Minister Dix has anything further to add, but I'm glad you're asking about youth, and I'm glad you're asking about young adults. One of the first steps of engagement was, of course, with our COVID Speak survey. And one of the things that youth and young adults have told us is that they are actually feeling a lot of the consequences of the pandemic. But the pandemic itself, as well as our control measures in terms of mental health, in terms of ability to make ends meet. So one of our goals through our schools and through our communication plan is to make sure that we engage with young people through their universities, through their workplaces, to really consider what their needs are to gather what are the safe ways of doing so. So I think it's a really good question and a really good goal. It's something that we are developing a proactive communication strategy to specific communities and specific sectors of our society so that we can look at their needs in order to gather safely, in order to limit their numbers to small numbers and make sure that they meet their needs in terms of work and education. And Minister Dix, I think, has further details to add.
Thank you. It certainly is something that I've been doing over the last number of months, is a lot of Zoom calls with young people and seeking, because I think communication to young people is best often carried out by young people. And so we've been seeking influencers. We're asking people to be part of health authority campaigns, to be influencers of one another. We're obviously reaching out broadly to communities. If you look at Fraser Health, you look at the relative number of people that are hospitalized against the number of people who have tested positive for COVID-19, you'll see that a number of certainly the evidence of severe illness isn't there as much, and this can have some consequences in the way that people see the pandemic themselves. So we need to engage young people. They're affected by this, and they have paid a significant price. I do want to say, though, that many of our leaders in this effort have been young people in communities, and I very much appreciate their efforts. And I also want to say how much I appreciate the work done every day by people both at the post-secondary level, but also obviously in schools, both elementary and secondary. In BC, the role that and the leadership shown by teachers at the classroom level with another group of youth, people under 19, who are obviously have also paid a significant price in the pandemic, the loss for many of them for months of in-class education, all the consequences that come to that. And I want to express my appreciation to the young people who are showing leadership out there. We need more of you, and to teachers and others who are playing an extraordinary role. We're grateful for all your efforts.
Do you have a follow-up, Moira?
I do. Obviously, we won't know the exact impact of last week's social gathering order for another week or so. So I'm just wondering, like, what would the next step of orders or of guidelines be if we don't see that have a positive impact, pardon me, a negative impact, but a good impact on the number of cases that we are seeing in BC?
So with respect to how we look at our interventions, how we design our interventions, we look at where transmission is occurring. That is our guidance for designing interventions, for delivering interventions. We look at where transmission is occurring, and we address the problem. And I think that's really important. If you look back at the interventions, the guidelines, and the orders that have been put in place, they were in response to ongoing transmission in certain settings, in certain related to certain activities. So the question of what the next guideline would be, or what the next order would be, really depends on what the transmission is like. And I think that's one of the things that I would like to emphasize. I think it's important for people to know that thought goes into all of this all the time. And one of the things that we do in British Columbia, and of course throughout the world, is to monitor this epidemic and respond to where the problem actually occurs, where transmission actually occurs. It's a science-based response, so it's not something that we can predict ahead of time, but we certainly are monitoring the data all the time, and we are responding to the data.
We have time for one more question this afternoon, and for everyone listening today, there will be a statement released this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For medical guidance on protecting families and communities, and for access to provincial guidance on COVID-19, visit bccdc.ca. For information about province's pandemic supports, visit gov.bc.ca/COVID-19. And the last question for this afternoon goes to Joel Ballard, CBC.
Hello. This question is for Minister Dix. Minister, you're already warning British Columbians to prepare for virtual holiday celebrations in November and December. Is there something that can be done now by the government to try and change that trajectory, whether that's a temporary period of increased restrictions or anything like that?
I think what I'm saying, and what Dr. Gustafson and Dr. Henry are saying, is that we're in a period now in November and December when days are shorter by an hour this weekend, at least at the end of the day, and time when the weather's getting worse and there's more things going on inside, and that we have to be even more conscious than we are in summer about the steps we need to take to be safe. And so we're going through a period of where there's a lot of celebration. We just went through Halloween, and we're going to have Diwali, we're going to have Hanukkah, we're going to have New Year's, we're going to have Christmas, we're going to have other celebrations. And so what we're saying right now very clearly is that private gatherings are a problem. I think that's what Dr. Gustafson and Dr. Henry said, and how they acted with respect to the provincial health order that was put in place last Monday. So what we need to do, it seems to me, now is to follow that guidance and to follow those orders, and that they're more important now than ever before. That the orders being provided as we see significant case counts, they're more important. So what can we do to make things better? Follow the advice, follow the guidance, right? And that means no more than 6 people outside those living in a home at a gathering. And if you can avoid it, less than that. I've told people I live in an apartment between 800 and 900 square feet. 6 in our living room is too much. So you have to use your COVID sense. And all of us have to come together to help flatten this curve, because growth in cases have consequences for all the things that we want to do, even Christmas. But I believe also that that we can have in this year, we can have virtual celebrations and other celebrations that are meaningful for people, that we need to do that we must do that. And so I don't say any of that with pessimism. I say that these are the things we have to do now to keep the ones that we love safe and to keep the ones that we don't know safe.
Do you have a follow-up, Joe?
Yes, please. Do you mind just answering that in French, and that's our follow-up for today?
Je dois faire des réponses plus courtes en anglais pour le but de la traduction. Oui, force est de reconnaître que c'est une période difficile dans le monde pour COVID-19. On voit ce qui se passe en France, au Québec, en Ontario, aux États-Unis, un peu partout dans le monde, en effet, où on a des cas qui montent, n'est-ce pas, le nombre de cas qui montent. Donc, il faut prendre l'action. La direction de Dr. Henry, la direction de Dr. Gustafson, c'est une direction fondée sur l'évidence, sur la science. Cela peut nous aider à avoir une période de Noël, une période de la nouvelle année positive, d'avoir des célébrations positives. Donc, mais il faut prendre l'action maintenant, et je pense que cela peut nous donner, nous tous et nous toutes, l'agence d'agir d'une manière d'aider tout le monde, nos amis et ceux qu'on ne connaît pas, de vivre mieux. Donc, il faut vivre avec cette pandémie pour des mois et des mois à venir. Et donc, il est nécessaire pour tout le monde d'agir d'une manière généreuse envers tout le monde, bien entendu, et donc de prendre l'action maintenant qui est en mesure de réduire la transmission de COVID-19 un peu partout dans la communauté. Merci beaucoup. Thank you very much.
Thank you all for joining us this afternoon.